You and I, we take something like 22,000 breaths every single day, and we don't even think about it. But what happens when breathing out, that simple act of just letting go, suddenly becomes the hardest thing you do? Well, today, we're going to dive into that very mystery, the struggle to exhale.
Yeah, it sounds kind of backward, doesn't it? I mean, we always think of breathing in as the hard part, the active part, but when exhaling is the problem, that's a huge clue that something very specific is happening deep inside our lungs. So let's break down what's really going on.
Here's our game plan for this explainer. We'll kick things off with the struggle itself. Then, we're going to investigate two major culprits. One that's all about the airways, and another that's about the lung tissue itself. After that, we'll see how doctors tell them apart, and why getting that final diagnosis right is so absolutely critical.
All right, first up, let's talk about the plumbing of your lungs. This first syndrome has a fancy name, bronchial conductance failure. But really, all that means is that the pipes carrying the air are having a serious problem.
So here's the bottom line. The pathways for air are getting squeezed shut. Think about trying to blow air out through a pinched straw. That resistance, that difficulty, that is exactly what's happening inside the bronchi. Air gets trapped inside simply because it can't get out through those narrow tubes.
What's really interesting here is how different diseases all lead to the exact same problem. With asthma, you've got a temporary spasm and swelling that closes things off. With chronic bronchitis, though, the damage is more permanent. The airways literally get bent out of shape. And with bronchiolitis, it's pure inflammation that's squeezing those passages shut.
So how would a doctor even begin to figure this out? Well, the number one complaint is that struggle to breathe out, usually with a nasty, persistent cough. During an exam, a doctor might tap on the chest and hear this hollow, box-like sound, which is a dead giveaway for trapped air. They might also check for something called vocal fremitus. That's the vibration they feel on your back when you speak. It gets weaker when air can't move well. And through the stethoscope, they'd hear a super long exhale and these distinct, dry, rattling sounds.
Now, this is where you can literally see the problem. When a doctor looks at an X-ray, the lungs look darker or more transparent than they should. And why is that? It's because they're overfilled with all that trapped air, and X-rays just pass right through air. It's a perfect visual confirmation that the air is going in, but it's not coming out.
And here it is, the hard data, the smoking gun, really. To measure this, doctors use a test where you take the biggest breath of your life and then blast it out as hard and fast as you can into a machine. In healthy lungs, you can force out way more than 70% of that air in the very first second. But with this kind of blockage, that number drops. Big time. It's a clear, undeniable sign that something is in the way.
Okay, let's switch gears and look at our second syndrome. We're moving away from the pipes now, and we're focusing on the tiny little air sacs at the very end of them, the alveoli. This condition is called emphysema.
If our first problem was like a pinched straw, this is totally different. I want you to picture the alveoli as millions of tiny bouncy balloons. Well, in emphysema, those balloons get overstretched. They get saggy. They completely lose their bounce. So they can still fill up with air, but they've lost that natural springiness they need to push the air back out.
And emphysema isn't a one-size-fits-all thing. There are actually two different paths to it. Primary emphysema is the rarer kind. It can just show up on its own, sometimes because of genetics or simply from getting older. But the road taken much more often is secondary emphysema, which is the direct result of long-term damage from another disease, and the number one cause is chronic bronchitis.
And this shows you that unfortunate domino effect. The constant blockage and inflammation from chronic bronchitis puts so much stress on those delicate little air sacs that, over time, they just break down. This is how the pipe problem can lead directly to the balloon problem. The two are just so deeply connected.
The physical signs here are, well, they're pretty dramatic. The main complaint is a shortness of breath that just slowly, relentlessly gets worse. And over time, the person's chest can actually change shape. Because the lungs are always overinflated with trapped air, the rib cage expands out and up, becoming rounded like a barrel. You might even see the pits in the neck bulge out from all that constant internal pressure.
So the X-ray tells a similar story, but with a brand new clue. Just like before, the lungs look extra transparent because of all the trapped air. But look down here at the diaphragm. That's the huge muscle right underneath the lungs. See how it's flattened out? The overinflated lungs are literally pushing it down, which makes it even harder to breathe.
Okay, so we've looked at our two main suspects, both of which make it incredibly hard to breathe out. Now, let's put them side by side so we can really see the differences. This is how a doctor starts to piece the whole puzzle together.
This table really lays it all out, doesn't it? Bronchial conductance failure is a problem of the pipes. Emphysema is a problem of the balloons. In one, the big complaint is a nasty cough. In the other, it's that crushing feeling of breathlessness. And while both can make the chest expand, that classic barrel shape is the real hallmark of emphysema, along with that flattened diaphragm you see on the x-ray.
So we've seen the clues. We've compared the culprits. But so what? Why is it so incredibly important to tell these two apart and get the diagnosis right? Well, this is where everything we've talked about comes together. It's because treating narrowed airways, like you would for asthma, is a totally different ballgame from managing the permanent damage of emphysema. Nailing down the root cause, is it the pipes or is it the balloons, is what lets doctors choose the right medicine, the right therapy, to actually help someone breathe easier.
I love this quote. It just sums up the entire situation so perfectly. It's such a simple analogy, but it's so powerful. Both problems trap air, right? But knowing if you need to fix the pipes or support the damaged balloons, that makes all the difference in the world.
So it turns out the simple act of exhaling is this incredibly delicate dance between flexible pipes and bouncy balloons. It really proves that even the things we think are most basic are built on this amazing and sometimes fragile complexity. It kind of makes you wonder, doesn't it? What other miracles is your body performing for you right this